It seems to me that viral infections are increasing, and that the number of people who get viral infections is also increasing. So we have both the number of viruses and the number of people involved that seem to be increasing. We'll be talking about this subject for the next half an hour. I'm Agatha Thrash from Uchee Pines Institute, and some of my helpers from there will be discussing this topic. So we hope you'll join us.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
Sometimes it is quite difficult for us to make the diagnosis of a viral infection. Sometimes a viral infection will appear to be a trauma, or will appear to be some kind of collagen disease, or maybe we think it's an allergy. And sometimes we go this way and that way, and we may finally say, well, it for sure is an allergy. And I think that probably I have thought in myself as well as in my patients that an allergy was a virus, or a virus was an allergy, more than any other single mistake that we might make in diagnosis. So a number of years ago, my husband and I wrote a book called Food Allergies Made Simple, along with Phyllis Austin. And in this, we discussed the symptoms of various allergies. And if you were to read these, you would think that we were maybe talking about a viral infection, because they often sound exactly the same. So if you have some kind of affliction that seems to be an infection and it goes on for a long time, you have a fever, every night you have a fever, your muscles ache, your joints ache, you have a headache, maybe even you feel a little sore throat, it may not be a virus, it may be an allergy. But in dealing with allergies, we need to have some tools, and some of these tools are very simple. And I have asked my cohort at Uchee Pines, John Champion, to talk with you about an allergy that he deals with sometime. And so at this time, John Champion will talk with you. This is one of our health educators and administrators at Uchee Pines. John Champion.
Thank you. There's something that happens around here and around, I guess, all parts of the country. There's a little, in the fall and in the winter, people start getting the flu. The bug comes by. They find that their throat starts to bother them, and next thing you know, the glands are swollen on the side. They're running a temperature, and they're in the full swing of it. Well, I've had the same problem, and I'm sure you've had it too. And they get shots for flu and different things like that. Then I got to thinking one day. I said, well, God has a solution to everything. We may be among those who have a virus or a flu, and some people get it and some people don't. Well, I used to get it quite often. But for the last 5 years, I haven't had a virus. Those around me in the office with me, where I work, they've had the virus, and I haven't had the virus. I've had the beginning of the virus, though. But at the first symptom, something interesting began to happen. I reasoned that lemon, I've never seen a worm in a lemon, have you? Lemon is a natural antibiotic. And I said, well, perhaps also it could deal with the virus very effectively. So I thought maybe not so much in taking lemonade, but perhaps if lemon juice was in the area where the viral infection was just beginning, maybe it would take care of it. And so this is what I did. The next time I had the first sign, and of course I've come to recognize those signs, a little feeling in the back of your throat, it's a little bit raw, and you know what I'm talking about. You've had that too. And so I took the lemon juice, and I took it up, and I rinsed my mouth to get the area nice and lemony, and then held it in the back of my mouth. I said, well, let's give it a good try. Let me see if I can hold it back there for about 20 minutes to a half an hour. There's a little reflex back there that makes you want to swallow. But I held it anyway. And when a little bit went back and a little bit more swallowed, I just took another little sip, so that I kept the surface of my mouth all lemony for about a half an hour. After that time, I got up and I noticed that it was a difference, slight difference. And within 45 minutes to an hour, the sensation that had begun was finished. My flu was averted. And I said, well, maybe it's just a quirk. So the next time, it came around again, another flu. I don't know what flu it was, what number it was. But I did the same thing. I took the lemon juice at the first sign, and I held it in the back of my mouth, swished it around my mouth. I lay down so that it stayed in the back, make sure that it stayed there. And I found that I was getting a little better with that swallowing reflex. I could hold it a little bit longer, and for a half hour. And I found that it was gone. I didn't get the flu. And it's been over 5 years now, and I haven't had the flu. I've had the first symptoms of the flu, but I haven't had a flu or a cold in over 5 years. And I'd like to show you now with Melissa just how that is done. Melissa's coming up, and she's going to take a little swallow of it and then rinse it around in her mouth, and then she's going to lay down so that it stays in the back. She's doing very well. So that it stays at the back of the mouth, and try not to swallow. And she just relaxes and rests. I find that doing that the first thing in the morning, even before I go to work, or at night, or whenever it is practical. And it doesn't take very long. You can do it on your lunch hour. Whenever you feel that bug coming on, you can go ahead and have that simple treatment. It's a blessing, and it is very, very cheap. Now you can use lemon juice here, or you can use what is right here on the lemon or a lime. And you do exactly the same thing, whether it's a lemon or a lime, you do exactly the same thing. Listen. Thank you. This is a natural treatment that the Lord has provided for us. And at Uchee Pines, I've shared this with others, and even one of the physicians there, and they have tried it, and they've shared it with others, and I'd like you to try it. The next time you feel the first sign of the flu coming on, that sensation in the back of your throat that you know what it leads to, try some lemon juice. Take it, swish it around in your mouth, hold it in the back of the mouth, lie down for 20 minutes to a half hour. And then when you get up, rinse your mouth real well, because the lemon juice has a lot of acid and it etches your teeth. So rinse your mouth 2 or 3 times after you get up, and you'll find that with the blessing of the Lord, there are 2 more things that would be helpful also. One is, don't take any sweets for that day. Be sure you take nothing that has extra sugar in it. And the second thing is, drink plenty of water. And I believe God will bless you, even as He has blessed me.
I'm sure that He will. And you know, it's such a simple treatment, and of course it has vitamin C in it and a number of other nice nutrients that it certainly will do you no harm. And an interesting thing about this treatment is what John Champion was telling you, and that is that you take it with the very first sign that you've got the problem. And that's a rule of treatment. The sooner you begin treating it, the greater the likelihood that you have for success. So at the very sign of a symptom, consider that to be a signal from heaven telling you that tissue is about to be injured, and then you can institute your treatment at that time. Now I'd like to show you the differing signs or sizes of a virus. So let me just show you here on the board just what you can expect in the way of these very tiny viruses, and you can see why it is that we're having a problem with these viruses. Let us say that this represents the size of a small bacterium. Very, very small bacterium, requiring the high power lens of a microscope in order to see it with oil immersion. Then, if that's the size of a virus, of a bacterium, then a very large virus would be perhaps this size, and a medium-sized virus would be perhaps that size. You can't see these with a microscope. And then a very small virus would be quite tiny, of course, very much submicroscopic. Now, as we think about the fact that these are the sizes of viruses as compared to ordinary bacteria that we're exposed to all the time, then we can see why it is that the Bible calls this the pestilence that is hidden. We don't see it. It walks in at midnight. And certainly these are viruses and pestilences that are in the dark. We cannot see them. So we need to protect ourselves from them even though we can't see them. That means when we get fruit from the grocery store, we wash it first. It's not taken to the refrigerator and stored in our refrigerator with all of our other food. We take it first to the sink and wash it. And if you think it might be fairly contaminated, wash it with soap. Sometimes some fruit has been not handled by human hands since it did have a washing period. And if so, you may only have to wash off the grocer's fingerprints, as well as those who come by to pick it up and they wipe their nose and they cough on their hands or whatever they do, and then they touch the fruit, and their viruses from their illnesses are now on the fruit. If you eat that unwashed, then you are subject to the kind of illness that they had. Now, we have a number of treatments other than those having to do with lemon juice, and Don Miller is going to show you some of those. Don Miller, it looks as if you have quite a lot of things here, and I think that we're going to do hydrotherapy.
We're going to do hydrotherapy, and the reason why I've got this one right here is Melissa is busy right now with her lemon juice, so I have to use her doll here to demonstrate the particular treatment that I'm going to be showing you. I want to show you what's two different types of packs, we're going to call them. One is what's called a wet sheet pack. Now, Dr. Thrash has showed you the relative size of a virus. It's a very small enemy, but we can attack it in a very large way using something as simple as hydrotherapy. And I believe in hydrotherapy very much. What we want to do when we do a wet sheet pack is basically that's what we use, and I'm going to use for this case just a wet towel, and it's going to be a dry towel. This is what we call a dry run. But we take a towel, in the case of a large human, a sheet, and put it in cold water and wring it out. And then we're going to take the patient, and what we normally have them do, and see this one's frowning because she's not too well today, we'd have them raise their arms, but she doesn't raise her arms very well. But the reason why we want to do that is we take the sheet and we take it.
Perhaps I could help you.
That'd be a good idea. She's not very cooperative today. You want to have every part of the body touching the wet sheet. And so what we do is we take the sheet and we start over and cross it over the body and go underneath the arm and then around this leg over here, because it's got to be completely surrounding the leg. Then the other part of the sheet will go across the other way, this time getting this whole arm. This part of the sheet's underneath the arm, this sheet's over the arm. This one came from behind the under the arm, and it goes over the arm. And then the bottom of it then tucks around this other leg. Basically, she's completely covered now by a wet sheet. And what we can also do is we can use a hot foot bath to accelerate the treatment or the vigorousness of this treatment. We put her feet in hot water. At the same time, we'd want to take a blanket or a towel and drape her shoulders to keep her from getting chilled. You do not want a person receiving this treatment to become chilled. So I would drape the shoulders, and then I would wrap the entire body in another blanket or a towel, as the case might be. For a child, you can use a large towel. But now the child is being wrapped up. Now what's happening inside here is you first put down this wet cold sheet. Well, that's going to cause an immediate reaction of a vasoconstriction. But the body is jealous for warmth and for healing, and so it starts sending blood to the area to increase the warmth of the area. Now, as that temperature goes up, which now this is an entire body, the temperature is going up. When the temperature goes up, we are rallying and increasing our white blood cells. We're saying, white blood cells, it's time to get to work. And so now our spleen and our white bones, our white bone marrow starts producing white blood cells, I'm trying to say, and we have far more white blood cells in the bloodstream out there fighting these little viruses to try to bring down the disease process. And this treatment, now the first maybe 10 minutes of the treatment, it's a stimulant treatment. It'll really get a person riled up because it's cold, but then it becomes, as it starts to heat up about body temperature, a sedative treatment. But as it goes on beyond that, it becomes a pyrotechnic treatment, if I can use the term. It heats the person up and gives the person a fever. And a fever is what we call a friend. It's not an enemy that we have to throw aspirin at. A fever is a friend. And as the person's temperature goes up, as I've already mentioned, white blood cells increase and healing takes place. And before long, instead of having a sickly and sorrowful patient, you have a happy patient because now they're feeling so much better for the treatment. Now there's another thing you can do in this type of a treatment. Rather than using the wet sheet, you can do what's called a blanket pack. And what I'm going to do with this particular treatment is lay my patient down. First, I would prepare the bed, and always prepare the bed before a patient treatment begins. I'd put a blanket down long ways and a second blanket long ways on the bed. And then I would lay the patient down in bed, and I would cover the patient with these blankets. Now, at the same time, you can be adding what we call a fomentation. And you can do a fomentation quite simply at home. Just take a towel, and what I would do is I would put it in fourths, dip it in hot water, wring it out, and then lay it over the first layer of the towel or the blanket that's over the part of the person. And you want to have these things all the way up and down the legs. It sometimes takes for a full-grown adult 12 different towels or fomentations to give this heating effect. And you don't want to put it right against the skin because it should be as hot as you can make it. So you put it against both legs, the abdomen, the chest, and the arms, and then you wrap them up in these blankets. Wrap them up like a mummy. Wrap them up like a papoose. Wrap them up like a dog in a blanket, a pig in a blanket, whatever you want to call them, and you put them there, and this is going to start causing that temperature to rise in the body. Again, white blood cells are increased. They become more voracious. They're a lot faster, and they're much more active. And this is what we need to fight our viruses. You know, many times we go to a pharmacy or something and get some type of antibiotics. Antibiotics do not work against viruses, but God's methods of hydrotherapy do work quite nicely. And so this is a simple treatment. I've used it before on myself and used it on others, and we get some quite nice effects out of these simple treatments, Dr. Thrash.
Yes, and we have patients who have smiley faces and not frowny faces.
That's right.
Herpes is a member of the virus family, and it itself is a large family. The virus that causes chickenpox and shingles is a member of that family, but also the virus that causes fever blisters and genital herpes is also a member of that family. There are several other members of that family. It's a fairly large family. Now, when a person gets the herpes virus, is there something that can be done? One way that a person gets herpes infection is herpangina. It may start as a herpes infection, or it may be a pain in the mouth that feels like a herpes infection. The symptoms of herpangina, which sounds like a viral infection, the treatment for it is hot mouth washes and a simple diet and sunshine exposure and keeping the mouth rinsed as well as heat treated. And since it occurs in children, sometimes the mother has to irrigate the mouth instead of asking the cooperation of the child. The child will get swollen gums, bleeding gums, and the teeth may become almost covered by the swollen gums. And then after the treatment is done, the gums are just as sound as they ever were. Now, a fever blister is a true herpes infection, and it is associated with the deposition of the virus in the tissues of the lip. So wherever it strikes the person, it generally lives there. And it may live there for decades unless for some reason the person is able to throw it off. One way that you can treat fever blisters is with cayenne pepper. Just mix up some cayenne with alcohol and dab it on the area where you have the fever blister. You can expect that it will burn intensely for about 15 minutes. But then, if you are successful, it will be very helpful in getting rid of that herpes infection on the lips. L-lysine can also be used to treat a viral infection, and hot baths can be used to treat a viral infection. So as we learn these various treatments for an infection, we can be armed against them. Now, the next thing that I would like to present to you is that of heating compresses. And John Champion is going to talk with you about heating compresses. And the heating compresses can be applied in many areas. And here you come with a number. So I'd like to see how you put these on.
Well, thank you. Heating compresses, you might think that we put on something hot, but we don't. We put on something that's cold. Melissa is going to be my subject. We're going to take this cloth and put it in cold water or ice water. It is wrung out where it's not completely dry, but it is fairly dry. This goes on. This is going to be for her neck. All right. What this does is, of course, it causes the blood vessels to constrict, and while they're constricting, the body is saying, well, we can't have that. We've got to heat this place up. And so what it does is begins to heat up this area. Now, first cloth goes on, it's dipped in ice water or cold water, and then it's wrung out and placed on the neck. Then it's covered with the plastic. The plastic should cover the entire area. And then above that, I'm going to use a sock, which is something that you have in your home. Would you hold it up, please? Thank you. All right. And that will cover the heating compress. Now, this can be slept in very comfortably for a person that has a sore throat, and it is pinned, okay? This is a heating compress. The body will begin to heat this up, and as it heats it up, there's more blood drawn to the area, and the sore throat that she has will begin to go away. It's not uncommon that in the morning when she takes this off and then takes a little mitten in the morning, it should be very warm, and then rub the area very briskly and then dry it off so that the pores can be closed. This simple procedure is very effective. Thank you, Melissa. Now, if the person has a cold and they'd like to work with their feet, they may have cold feet, the same thing can be done. You can take a very thin cotton sock and do exactly the same thing that you did for the throat. You can do it for the foot. You would take this, dip it in ice water, wring it out, place it over the foot. You want to, when you do the feet, though, you'd like to do both of them, one on each foot. Then you take a plastic bag and put the foot into the plastic bag, cover it completely, and then put a heavy sock over that. So you wind up with 3 layers. The cold, wet one, the plastic, which the foot goes in, and then that goes inside here. And again, you'd have exactly the same thing that you had for the throat. The feet would warm up during the night. They would feel chilly initially, but then they'd warm up, and the person would feel very well in the morning. Now, you might have congestion in your chest, in this area. You could use a band if it was for the abdomen area. If you had like constipation, you could do the same thing. You could use a band, and you would do exactly the same thing. Now, if you had your entire trunk, you had congestion in your chest, you would take a shirt without sleeves, and exactly the same procedure would be made. You would put it in cold water, wring it out, and place it on. It would feel very chilly. Then over top of that, you take this is a garbage bag, and a hole is cut out for the head. A hole is cut out also for each arm, and slip it over the person or for yourself. Then over top of that, you can place a sweatshirt. So the same procedure can be used for many different parts of the body. This could be worn during the daytime. I've known folks who have placed this on themselves and worn them during the day, or the collar during the day also. So this is one way that we can deal with some of the health problems that, with the material that you have in your own home, it's very inexpensive and very effective.
You know, as I was thinking about your doing this, I thought of many cases where I have recommended this kind of treatment, and the person has said, my affliction is too severe for that simple treatment to be helpful for me, and they simply refuse it. And I think about what happened in the Bible when the remedy for the bite of those serpents was given to the people. The brass serpent was raised up on the pole, and the only thing that the sick Israelite had to do was to look up on that pole and see that brass serpent, and they would be healed. But many of them refused to do it and died of their affliction. Don't sell these simple remedies short. They are very effective, and I would like to encourage you to learn how to do them. You will enjoy them.